what is your best piece of advice for a patient who is searching for their surgeon?
Perfect. So we get asked a lot of questions on all of our social media platforms, and I would say this is probably one of the most frequently asked questions. How to find a surgeon. Dr. Madnani, I'm not in your area. I am in so-and-so state. It's hard for me to travel all the way to New York City, even though I highly recommend it. How do we research doctors in our area? I get a lot of requests for referrals for doctors in your area, and once again, I don't know doctors in every single state, and I cannot speak to the quality of the work as I don't know them personally or seen their patients personally. However, these are a few things that you as a prospective patient can do to find a competent surgeon in your area. Number one, word of mouth is always a great referral source, so ask for your friends. However, if your friends have had a breast augmentation and you're looking for a facelift surgeon and they refer you to their breast augmentation doctor, I think that's fine, but really find out about how many facelifts they actually performed. Mallory, you used to work with other plastic surgeons, correct?
Correct.
Now, you wouldn't suggest I do anybody's breast augmentation.
Correct.
And your other surgeons that you work with, did they do a lot of facial surgeries, or was it primarily body work?
Primarily body work.
So would you, as a PA who sees people in the operating room or surgeons in the operating room, would you suggest, hey, find a surgeon that can kind of do everything and does a facelift once in a while? Or do you think the quality of a surgeon's work who performs a lot of one surgery is probably better?
I agree with you that a surgeon who performs more of one surgery does tend to have higher quality surgeries in that particular specialty.
Now, there are exceptions to that rule. I think there are surgeons who can probably do everything, but once again, I feel more comfortable doing only facelift surgery. I don't even do rhinoplasty because I'm so focused on I'm lucky enough to have a practice that we can focus primarily on facelift surgery. So that's all we do. My whole team is set up around that. So that's the first thing, find the surgeon in your area that primarily does the surgery you are looking for. So we're going to talk about facelifts today. So find a surgeon that does primarily facelifts. How do you do that? You can start with a Google search. There are other online resources especially for cosmetic surgery sites such as Realself. There's some medical sites that grade physicians, but understand that I know even for Castle Connolly or other types of top rating doctor sites, sometimes we have to pay to get advertised on those sites. So take those sites with a grain of salt, but Google is a great place to start. Also, if you're looking for a facial plastic surgeon, a lot of facial surgeons may not do cosmetic facial surgery. They may do more reconstructive facial surgery. So that's also a distinction in terms of what kind of surgeon you're looking for. Other ways to look at when you look for surgeons online is go a little further in terms of research. And once you find a few doctors, I wouldn't go searching 200 doctors. I'd search maybe 2 or 3 doctors and then look at their website. Do they do a lot of facelift surgery? Are you seeing a lot of before and afters? Are you seeing a lot of before and afters if you're a patient of color? Do you see a lot of before and afters of male patients? Review their credentials online with respect to board certifications, medical schools. You can, if you want to get very granular, you can look up their malpractice histories and stuff. It's all public knowledge. Once you found the surgeons that you have researched, you make appointments. When you call the surgeon's office, you maybe want to get ballpark pricing over the phone. For us, on our website, we list the prices for all the surgeries that we perform. We have other doctors in our practice that charge different than what I charge. However, we are pretty transparent with our pricing, but it's hard for me to say, hey, your price is going to be this, or it's hard for my team to give you a specific price without seeing you in person, because you may need an upper eyelid blepharoplasty and the other patient may not need an upper eyelid blepharoplasty, or you may need a facelift with a neck lift and the other patient may need a facelift with fat transfer and a neck lift. So the pricing will vary based on exact combination of procedures being performed. Once you've found some doctors that you want to meet with, you call the office, make an appointment. In terms of preparing for the appointment, I'll do another video about that. And then in terms of what to ask when you see the doctor, you want to once again review before and afters, but by this time you probably have seen all of their before and afters. You want to review exactly how the surgery is going to be performed with respect to anesthesia types. We offer local anesthesia and IV sedation, which is like a twilight. I don't do general anesthesia. I just find it safer and less risky for the patients. Ask about risks of surgery, ask about where the incisions are placed, ask about the aftercare, which sutures are being removed, which sutures stay in, ask about medications you get afterwards. And then I think these are all reasonable questions to ask the doctor. What are your common complications? In terms of what happens commonly, and then what happens rarely. And then how do you handle that? Does the doctor, for example, all my patients get my cell phone number after surgery? How are you able to get in touch with the office? What's the system we have that's called?
Clara.
We have Clara. Perfect. So it's a secure messaging system where our patients can communicate directly with my nursing and clinical staff. They can send pictures and we can review any concerns that they have. We can even do video conferencing at that time. So these are all questions to ask your surgeon. Ask about the aftercare, ask about typical recovery, and then obviously payment and those kind of questions you would ask the doctor at that time. And then once you've met a few surgeons, maybe 2 or 3 surgeons, then you go with your gut. You see which surgeon you feel like you get along with the most, but also whose results you like the most. Because every one of us, even though we do facelift surgery, you'll look at our before and afters and you'll see after a while, you'll see a trend in terms of how the patient's faces look after surgery. And you have to be happy with your surgeon's aesthetic, as we all differ slightly.
In regards to price of a facelift, where does price versus result come into play in your mind?
I think surgeons who have been in practice for a long time, and I consider a long time more than 10 years, and who have performed thousands and thousands of procedures and get consistently excellent results, those surgeons are going to be charging more, in my eyes, than surgeons that are newer starting off or don't do the procedures as often as the surgeons who do.
How does a patient from out of state get a facelift in your practice?
Great question. So we are lucky to have about 20 to 30% of our patients travel from afar, means outside New York or New York City, to get facelifts with us. We have a pretty streamlined process where patients are able to contact us and we set up virtual consultations. Once again, most of the research has already been performed, so the patients are kind of set on having me as their surgeon. They've reviewed my before and after, seen my reviews online, seen all the work that we post in terms of, I like to post how the surgery is performed because I want to make the OR or the operating room not such a scary place, or what I do not such a scary thing, or to show that I am able to do what I do without the general anesthesia, and to show how patients recover about 90% of the time within about 10 to 14 days as opposed to months and months. I like to show all that to show that it's possible. And we have many patients that don't want to have anesthesia or general anesthesia, and they aren't aware that they can still get their facial rejuvenation done. Aside from all that, we love all our patients, but the ones from out of state, we handle them a little differently or manage them a little differently, as most of the appointments are managed virtually. Your pre-op appointment, pictures, medical histories, if a medical clearance is needed, can all be handled virtually, because I will speak to the patient, my clinical staff speaks to the patient as well, and we make sure everyone's on the same page with respect to the before care and after care that's required for surgery. And then typically what I like is to have my patients, if they plan on leaving 1 to 2 weeks after surgery to go back to their homes, is to have somebody local in case there's a little stitch that's been left behind, or in case a little steroid injection is needed, to have someone available. And that can be a primary care doctor, urgent care, dermatologist, or plastic surgeon that can help manage anything post-operatively if needed. And 90% of the time, nothing is needed. About 10% of the time, something else may be needed. And I think that's about it. Did I miss anything, Mallory? No? Thank you.